In the never-ending struggle against deadly diseases and biological threats, the Air Force Small Business Innovation Program has funded the development of critically important medical and diagnostic devices. This is the story of the FilmArray, a diagnostic device capable of quickly identifying the most dangerous pathogens on the planet.
Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States.
When the deadly Ebola virus spread from West Africa to the industrialized world, containing the outbreak meant quickly identifying and quarantining infected patients, then monitoring their treatment. In Salt Lake City, Utah, BioFire Defense had a solution ready to go: a PCR amplification and diagnostic laboratory in a box called the FilmArray.
The FilmArray is a platform that is extremely easy to use. You inject water into one side of a cartridge and a sample into the other. Everything else is automated inside the system.
The ease of use and small size makes it practical for medical personnel to do bedside monitoring of patient treatment, while cutting the time to get back diagnostic results, as was the case with Kent Bradley, an American Ebola patient treated at Emory University.
When you're talking about a high containment facility where you have a patient that is in very isolated quarters, having the ability to test right at patient side is a big advantage because it cuts the testing time down to an hour rather than 12 to 48 hours.
This versatile and practical diagnostic device was made possible by a technological development funded by the Air Force SBIR program in the late 1990s.
There was a problem that had to be solved, and that was that it is difficult to ship molecular diagnostic reagents around the world. The reagents had to be stored frozen, and shipping them was a real problem. So you'd take a tube like this and ship it on dry ice to remote locations, which is a real problem if you're shipping to Africa. So we wanted a system that you could have a box of reagents, send it anywhere in the world.
The solution they came up with was a freeze-dried vacuum reagent pouch.
The SBIR grant gave us the ability to take our previous system, which would require a technician 2.5 hours of labor to get a sample just into the platform, down to a technician taking 2 minutes of hands-on time before sticking it in the machine to get results for 20 different pathogens.
The freeze-dried reagents are at the core of all of our subsequent products, ever since this SBIR grant got us started down this path.
75 of the most common and deadly viruses, bacteria, and fungi can now be quickly and easily identified by the FilmArray. Moreover, this allows doctors to identify what a patient is not suffering from.
Being able to respond in an outbreak of dengue or chikungunya or Ebola really means being prepared to diagnose the more common and more probable causes, and at the same time being able to identify Ebola in the patients that actually need that level of isolation and care.
Finding out what is making a patient sick quickly, accurately, in an easy-to-use manner dramatically improves the outcomes for patients.
Less antibiotic usage, faster turnaround times. We can diagnose the patients a lot faster, get him treated, get him under the right therapy, decide what to do with him, either get him admitted or send him home with the right kind of therapy at home. So it's really revolutionized the way we treat respiratory infections in children.
This is paradigm changing for hospitals who have traditionally sent their lab work out to reference laboratories. Our system puts that in a small box that sits in the hospital laboratory and provides an answer in an hour. And it's easy enough for a kid to use it.
The FilmArray, a breakthrough in medical devices developed with funding from the Air Force SBIR program.